Coronavirus pandemic, with more than 19,000 people now having died here in the United States from COVID-19. That death toll higher than any other country. In fact, it has just surpassed Italy. The number of confirmed cases in the United States now almost 500,000. You see the numbers there. A temporary medical care facility now open in Detroit as that state's case count nears 23,000. It was built inside a convention center. It'll house up to 970 beds. Meanwhile, the state's governor, Gretchen Whitmer, has put in place tighter restrictions on residents. Starting today, travel between two residents is not permitted. Going to Texas, residents there under a stay-at-home order for the rest of this month, but some businesses could reopen before then, according to Governor Greg Abbott, who says he will release an executive order next week detailing a plan to get Texans back to work.
We will focus on protecting lives while restoring livelihoods. We can and we must do this. We can't do both.
Signs mandating that one-way foot traffic on the sidewalks against vehicle traffic. And as you can see from this video beyond the tree there, it looks like it's working.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on When you look at Black in America, number one, people unfortunately are more likely to be of low socioeconomic status. We know that Black people are more likely to have diabetes, heart disease, lung disease, and I and many Black Americans are at higher risk for COVID. It's why we need everyone to do their part to slow the spread.
It's the U.S. Surgeon General just this morning talking about the heightened coronavirus risk for African Americans. Some states have released the racial breakdown of cases and deaths, and those numbers show a disturbing trend. A disproportionate number of African Americans being infected with coronavirus and dying. Joining me to share their expertise in their reporting, Dr. Kamara Jones, the former president of the American Public Health Association, Politicos, Laura Barone Lopez, and CNN's Van Jones. Doctor, I want to start with you. And I've just put up some numbers. I'll get deeper into them in a moment, but just these side-by-sides. Illinois, African Americans make up 15% of the population. They are 42% of the state's coronavirus deaths. In Louisiana, African Americans make up about a third of the population. 7 in 10 of the deaths in Louisiana are African Americans. In Michigan, it's about 14% of the statewide population. More than 40% of the deaths in Michigan. It's a combination of what is your biggest takeaway on why this is happening and what can be done?
In December 2019, jobs so that we're more exposed and less valued, don't even have the protection that we need. And this chronic, the residential segregation that turns into employment segregation, educational segregation, environmental hazard segregation. All of those insults in our bodies have given us more of these so-called pre-existing conditions. So once we're infected,
I want you to listen, Van, I want to come to you next, but I want you to listen to the governor of Louisiana, who's looking at these numbers and says, as Dr. Jones just said, this is a horrible thing and we better learn about it as soon as we can.
Right now, slightly more than 70% of all of our deaths are among African Americans, who make up about 32% or so of the overall population of our state. So obviously this is a big disparity, and we're going to try to figure out what that is attributable to and what we can do about that as quickly as possible.
And Van, as you come out, I just want to put the numbers, just Louisiana numbers up side by side. More than double your proportion of the population. When you hear the governor there, Van, I take him at his word that he is very well intended. You also know the history here. We have a crisis, everybody ramps up, a lot of money gets spent, and then some of the disparities that may have been a major factor in contributing to the crisis, when they're over, they either get forgotten, put aside, or there's not enough resources to deal with them.
Well, I was with the governor yesterday. I know that he because you are going to die. Well, I'm not 80 years old. No, it's not just age. In our community, it's going to be, are you sick? And black people are underinsured, underemployed, and barely healthy on a good day because of things that were just mentioned. We have to change the discussion. We can't say comorbidities. That doesn't mean anything to the people who are in harm's way. The people who are in harm's way, do you take pills every day? Do you got sugar, diabetes? Do you got pressure? High blood pressure, hypertension, you could die in a week. You could not be here. You've got to start screaming this to the black community, or you're going to have a catastrophe on your hands here.
He talks about the generations. Laura, again, I want to show you the Illinois numbers because I just think people need to understand by looking at the numbers and understanding the disproportionality of this. 15% of the population of Illinois is African American, 29%, double the population essentially percentage in the cases, and then 42% of the deaths. You've been doing a lot of reporting on this issue. Everybody's in crisis mode right now. Do the politicians get it for the long term, or will this fade when COVID is shoved aside by some other crisis?
Well, what's really key to ensure that this is something that doesn't get brushed aside after coronavirus is more contained is that data, and there's a lack of data right now. And this has been a long issue in the public health sector. Public health experts, epidemiologists have long warned on race and ethnicity across the states. There's elements where the chain of reporting race and ethnicity gets broken down, whether it's the physician not writing it down because they're overwhelmed during the pandemic, or once it gets to the testing labs, a lot of them actually don't even have a space where the physician can write in ethnicity. So that leaves populations such as the Latino population potentially having nowhere to put their ethnicity when a physician is inputting that. So there's a lot of there's lots of lacking data right now when it comes to this, and that's important. It's important to have those numbers because then the policymakers I was talking to, whether it's local, state, or federal, say that only then, once they have that information, can they make decisions about where the federal funding is going, whether or not resources need to be redirected to different communities, to minority communities, if they're being hit harder. And so that's really the key.